welcome again. Now you can see me and you can see the slides. Hey, this is what we're here to talk about, specialized residential settings. And we had a few housekeeping reminders. Yes to slides, yes to recording. No, you cannot unmute yourself. Please use the Q&A. That's the quick version. Let's move on. Okay, and we've got some phenomenal presenters, several of whom you've just heard as we're trying to troubleshoot. And so I'm not going to go back over that again, but hi, Dina and Kirsten. We didn't hear from you guys, but I see that you're here. Okay, back to what are we going to be talking about today? Yes? Okay, so we are, as I was saying, going to be laying the foundation first with overall child welfare response to trafficking and exploitation, changes under Family First related to placement. Then we will be talking about how this fits with the broader safe harbor response and what these specialized settings across the state could look like. We will be concluding our time together actually today, looking at some of the documentation changes related to documenting identification and placement eligibility in SSIS. So let's move along and get into it. So when our group of co-presenters came together, we really wanted to figure out in this opportunity when we are so close to implementing Family First, what is most important for all of you to walk away with in terms of clearer understanding. I want to recognize right now that there is so much changing so quickly and that this is going to have a profound impact on our child welfare system in the state of Minnesota and quite frankly across the country. And so what do we want to zero in on today? What are our hopes for our webinar today? First, we hope that you have increased certainty and some clarity in understanding the response. So first, how will these specialized residential settings for this population of youth impact you in the work that you do? Now, on that note, we are specifically hoping that many of you here joining us today are within the child welfare system or are in a position where you participate in the process of placing youth in out-of-home placement settings, or you are a partner who is working at some point along that placement process. We second are hoping to increase clarity as far as if you are in the position to make placement decisions, why would you choose this type of specialized setting for a child or youth that you're working with? Third, understanding a little bit about the continuum of what is available, both through Safe Harbor and in the community, as well as in residential congregate settings. What kinds of services can help the youth that you are working with, specifically youth who've experienced trafficking, exploitation, or who are at risk? And then finally, I labeled this, I needed another C, so I labeled it as convenience. But really, how will you easily and clearly, if you are a child welfare staff or case manager who makes placement decisions and documents them, how will you easily document everything within SSIS so that you can still continue to get Title IV reimbursement for appropriate placement? So that's what we hope you will learn today. Again, please use the Q&A to ask questions, and we will try to answer them throughout the presentation, and we'll have some time at the end as well. Okay, so the child welfare response to trafficking and exploitation. That is where we are going to start. And I put this image on the slide to begin with, the gap image, because we are actively trying to fill gaps in our state. And you will notice that as a theme as we go throughout our time together today. Okay, so what is our current response? Here in Minnesota, As many, if not all of you are aware, child sex trafficking is a form of sexual abuse, child abuse, and neglect. It does require, by state law, it requires an investigation by child protection. And that is regardless of who the alleged offender is. Now, specifically, we're talking about sex trafficking as defined in Minnesota. This is really important as we talk about out-of-home placement for this population of youth, because you will notice that the definitions and identifying the right youth who are eligible for these placements is really key. So first, the baseline is, what is the broader child protection response and what has to be reported? Sex trafficking as defined in Minnesota has to be reported to child protection, even if the alleged sex trafficker is not a household member or caregiver. Sex trafficking here in Minnesota does require a third party that is not the purchaser of the commercial sex act or the victim, but it is another person who is helping with that by either arranging it or profiting from it. Now, other types of sexual exploitation, even without a third party, can be considered sexual abuse or are considered sexual abuse if they involve a caregiver or other household member as an alleged offender. Just a reminder that for all of these, that law enforcement and child welfare have to cross-report. Okay, so that is our baseline for the child welfare response. Now, on the next slide, you'll see hopefully an image of a tool that is quite familiar to you if you are involved at all with screening at the Child Protection Agency level. So this is our intake flow chart. This walks you through the statutory definitions of sexual exploitation of youth and sex trafficking of youth. So this helps you to know how should your county, if you work for child protection, your county or your tribe, respond to a report of potential sex trafficking or sexual exploitation. Okay, so next slide. What does that look like here in Minnesota is where I want to begin. So since May 29th of 2017, from that date until August 31st of 2021, we have across the state of Minnesota received reports to 70 child protection agencies. And that total number of reports is 1,919 reports of children who have experienced sex trafficking or sexual exploitation. There are a lot of different ways that we can slice that data, as you can see here, but the main point that I want to make to you is that we do see it across the entire state, and we do see these reports involving children of all ages. Okay, so then when we are talking about trafficking and exploitation for purposes of out-of-home placement, keep that in mind. And I do want to mention again here, in case you've joined us late, that there is a link to the slides in the chat, and you will also get the slides in the follow-up email along with this recording. Okay, so next slide. That's our big picture about what it looks like here in Minnesota. The last big picture item about our response is that you can read so much more and get so many more tools to understand and to use as you are responding to youth who have experienced trafficking or exploitation in your community by visiting our website and downloading a copy of Minnesota's Best Practice Response to Trafficking and Exploitation of Children and Youth. This is a guide specifically for county and tribal child welfare agencies. And big note here to be aware of, we are in the process of revising it to include the information from the Family First bulletin that we published in April about these specialized settings, as well as other tools and information pertaining to changes regarding placement when it comes to this implementation of Family First, and a number of other things are being updated in the best practice guide as well. So please go ahead and reference that for the broader response, but I do want to note here as we shift into talking about these specialized settings for sex trafficked, commercially sexually exploited, or at-risk youth, I want to note that from the very beginning, when this mandatory response to sex trafficking and sexual exploitation began in Minnesota, we have been working with agencies across the state, both child welfare agencies and also partners like law enforcement and county and tribal attorneys and judges and safe harbor providers and many, many other providers, in addition to working directly with youth and with survivor subject matter experts to really understand what should this response look like so that specifically it is meeting the needs of youth who experience trafficking and exploitation in our state. And here is what we heard from the very beginning. The top 3 issues that specifically child welfare agencies, child welfare staff were most concerned about figuring out in this response were, first, identification and screening for trafficking and exploitation. Second, what should the investigation response look like that I mentioned just a moment ago? What should be included in that? And third, placement. Placement has been at the top of the list, folks, since we began this response, because we have known that there are gaps across our state in terms of what are the most effective, safest options for youth who need out-of-home placement and have experienced trafficking or exploitation. Next slide, please. So on that note, I wanted to get your attention with this slide. And speaking very honestly, this has been one of the largest challenges when we talk to survivor subject matter experts and when we are implementing this response within the child welfare system and with all of our partners, our safe harbor partners and others across the state. Over and over, we find that there are gaps in community and residential services for youth who have experienced trafficking and exploitation and have very high mental health needs. And so that is one of the things that I want to put on the table for us. I know if you pause for a moment, if you yourself have worked or do work currently with youth who have experienced trafficking or exploitation, I want you to think about this for a moment. Have you been in those situations trying to meet the needs, find the right services for youth when they are, let's say, running away from care? When you cannot find the right type of treatment options for them that will be able to work with them in their community, that will be able to work with them on trauma treatment or crisis stabilization. There's such a vast range of needs. And so I want to mention that as really the platform for the opportunity that we see in Family First. Okay, next slide. So I want to take just a couple of minutes here to zoom out to the balcony here, or to the bird's eye view about the Family First Prevention Services Act of 2018. So I know you all love it, you all know it, you've all read it. No, it's okay if you haven't read it. It is a massive law. So there are many, many different changes that are coming across the country related to the Family First Prevention Services Act. Specifically, these images are taken, these statistics are taken from the Annie E. Casey Foundation, and I want to put this out there as being really one of the reasons that the Family First Prevention Services Act is set up as it is. Okay, so the spirit of the law is to keep kids in their homes and in their communities if at all possible. And so looking at these numbers, there has been an increase in children going into foster care across the entire country. That is what you see in these trends that are creeping back up in the table on the left. Then other really significant kind of things to understand that informed this idea behind Family First is that very often across the country, the cost of group residential placement is very high, and also it's difficult to show in many situations why a child needs that level of care or how appropriate that level of care is for the child. So these are some of the big picture things that kind of informed the Family First Law, especially then in the next slide, when we come to looking at the changes to residential services. So if you have been in the series of webinars that DHS has hosted, this is all very familiar to you. There are 4 types of specialized settings: qualified residential treatment programs, settings for supervised independent living programs for youth over 18, programs for youth who are pregnant or parenting, and the focus of our time together today, settings that provide high quality residential care and supportive services to children and youth who have been found to be or are at risk of becoming sex trafficking victims. So that is specifically what we are here to talk about today, is these non-family congregate care settings that will be specialized to provide care to youth who have been sex trafficked, commercially sexually exploited, or who are at risk of sex trafficking or exploitation. Okay, so next slide. Before we go any further, you're going to see this slide twice, okay? Right now, this is kind of your spoiler alert, okay? This is just to kind of tee up for you and to remind all of you that the focus of the implementation of this provision in the federal law is actually to fill significant gaps in what is available for youth who have experienced sex trafficking, commercial sexual exploitation, or who are at risk for trafficking and exploitation. Okay, so over the course of our last couple of years, working with a large group, over 100 stakeholders from across the state, we have identified both short-term and long-term impacts, potential impacts of creating and placing youth in specialized settings that are specifically designed for this population of youth. So we're going to, as we go through our time together today, you should hear information about and learn and have the opportunity to ask questions about these short-term impacts and long-term. So very briefly here, basically short-term, we anticipate better training of staff across the state, more access to appropriate services, and possibly actually better services in residential care for youth who have experienced trafficking or exploitation or who are at risk. So as of today, just to, you'll hear about the Safe Harbor shelter and housing from Dina in a little while, but you will also hear that there are major gaps in what is available in terms of the types of residential placement for youth who've experienced trafficking and exploitation. And until Family First goes into effect in a couple of weeks, there hasn't been any type of specialized services or settings, and in a formal sense, at least, for youth who are identified as being at risk for trafficking and exploitation. Now, long-term, we have even bigger opportunities to have a positive impact in terms of actually preventing trafficking among youth who are at risk right now for experiencing trafficking or exploitation in their life. We also have the opportunity to change the way that we understand trafficking and exploitation and risk. And as you'll hear about today, we have the opportunity to fill some significant gaps in our continuum of services for this population of youth. Okay, next slide, please. Now we're going to get into it, folks. We're getting into the nitty-gritty. Before we do that, let me pause. I do not see any numbers of questions in the Q&A. I see a number of things in the chat. Is there anything from my co-panelists that needs to be addressed right now before we get into this next segment?
Sarah, this is Darianne. There are a couple of questions I think the biggest one to the slides that you just presented on is there is a question about if there was, let's see, oh, Tammy, I just lost your question. Is there any newer data as the report being referenced from Casey Foundation is 6 years old? I don't know if you.
Yes. Yeah.
And then the other two are bigger questions. So I think we could go into those at the end. So, but on that Casey data.
Okay. One. Sure, that's a great question, Tammy. And I certainly, in our written Q&A section, the Q&A document that we're going to send out, why don't I provide a link to some of the more updated data that Annie E. Casey Foundation has regarding out-of-home placement, and that should answer that question of yours. And then, yeah, that's fine. We can hold on the other bigger questions if that's what you think is best, Darian. Okay, so let's move on then. The process of implementation of these family first provisions here in Minnesota. I want to pause here to say thank you for your patience and thank you for your grace as we have been trying to figure out what this looks like. And thank you very, very much to all of you who have been actively engaged in one way or another, whether through some of the other parts of the Family First implementation process that DHS has been working through, or whether directly through our specialized setting work group. So thank you very much for all of you for your participation in this. We have been in a growing process when it comes to the Family First implementation. So across the country, states have taken various approaches to trying to figure out what this provision regarding specialized settings for trafficked and at-risk youth should look like. So on the next slide, you'll see this is the approach that we have taken here in Minnesota. I will mention and give credit that actually this slide even, and this kind of laying out of what the process has been shared with me by other states who also have walked through this same process. So when it comes to implementation of the specialized settings for sex trafficked, commercially sexually exploited, and at-risk youth, step one was to convene survivor subject matter experts, child welfare agencies, safe harbor partners, tribes, and many, many other stakeholders from across the state. In particular, I do want to mention also the large number of residential facilities that have joined us and come up alongside us in this work to do each step of this process. The first thing that we had to do together was to define these populations. And so we have created, as you'll see it with Darianne in a few minutes, we have created definitions and added definitions statutorily and also in administrative policy to define what it means for a youth to have been or currently be sex trafficked, commercially sexually exploited, or at risk for sex trafficking and sexual exploitation. I want to pause for a moment. You're going to see those definitions very soon, but the most challenging part about all of this, not only here in Minnesota, but across the country, has been to create definitions of what it means for a youth to be at risk for sex trafficking. There is a lot of research across the country that has kind of looked at risk for trafficking, but there haven't been many at all states who had actually defined that population for purposes of out-of-home placement. And so that really was key to deciding how big of a population is this? And what does that look like in Minnesota? Not just taking a big research definition, but really assessing with partners from across the state, what does it look like for youth to be at risk for sex trafficking or sexual exploitation? Then once we knew who the population was, we had to assess what do these youth specifically need when they need out-of-home placement, when it is not safe or appropriate for them to be with their family or in a kinship or foster care placement. What do they need in a congregate residential setting. Then we had to develop those standards, which fed into the certification requirements that you'll hear about today, and also fed into some of the guidance and some of the opportunities for residential programs as they are setting up their specialized settings. And then finally, after all of those things have passed in the legislature, no small task, but it has happened, then we actually are at this stage of now implementing. We are on the cusp of implementing and providing training on all sides, both for our child welfare and other placing agencies, and also for residential facility staff who will be working directly with this population of youth. Next slide, please. So the last thing that I'm going to end with, and I'm going to hand it over to Darianne here, is just to answer kind of an elephant in the room type question. Okay, so we looked at why family first. We looked at, we talked a little bit about the need to really keep kids in their community and with their family, and honestly, to make it harder to place kids in congregate care. So why then do we want to create these new specialized settings that actually have lower standards, as you'll see later, not lower standards in the care, higher standards in care, but the process is kind of easier than placing kids in qualified residential treatment programs? Why? So what the sense of Congress and also the sense of researchers and practitioners is really that this population of youth have unique needs that sometimes can be better met in a specialized residential setting for a period of time. And so some of those needs that are specifically analyzed in, you see a picture of this research report that was published related to how to establish these high quality service standards. This is what our standards are based upon here in Minnesota. So these are some of the key standards that are different for this population. Safety, 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 physical and emotional. Care being provided by highly trained staff. Okay, so there is then uniquely for this type of specialized setting, a training requirement for the certification to make sure that staff working with these youth do have appropriate training. Access to more specialized services related to their experience of trafficking and exploitation or related to the fact that they are at risk for trafficking. Much higher levels of collaboration and communication, specifically partnering with and under the umbrella of our safe harbor response. And then finally, one of our key opportunities, one of the key reasons why a specialized setting is important to have in our state is that this provides youth with access to trafficking prevention education across the board as a requirement for programs to be certified in serving this population. So that is the basic case for why. And now Darianne is going to walk you through what you need to know if you are going to be helping to place youth, making placement decisions for youth and with youth who have experienced trafficking, exploitation, or who are at risk. So Darianne, I'm going to hand it over to you right now to go to the next slide. Thanks.
Thanks, Sarah. And I just want to acknowledge Patty's question regarding balancing this work between the need for services and the issues and the unintended consequences, such as labeling the youth. And I will talk about that a little bit as I'm speaking right now, and then we'll also address it further at the end with all of our panelists, because that's something that we certainly have talked about throughout this process. So for really that, like, how are youth going to access and be placed in a specialized setting? So first, there will have to be the identification process through the counties and tribes, where they will identify a youth using the state definitions to determining the eligibility. Next, workers, caseworkers, and supervisors and those involved in placement decisions will look at the individualized assessment of needs of the youth and whether or not a specialized setting would be appropriate. And then also to have that conversation with the youth and their family, and then decide whether a specialized setting would be safe and appropriate. Because there may be times that a specialized setting might seem like the best idea, but maybe isn't the best for the youth at that time. And then the documentation piece. So within the first 2 weeks of a youth being placed in a congregate care setting outside of the home, the caseworker will need to document within the first 2 weeks the eligibility of the placement in a specialized setting. And we'll talk about the documentation piece in a little bit more detail towards the end, but that will be implemented come October 1st, where that documentation will need to happen within the first 2 weeks. Next slide. Oh, did I do that? Okay, thanks. Okay, so definition. So Sarah covered at the beginning the definitions of the for mandated reporting and a child protection investigation. And that is a little bit, not to confuse everybody, but that is different than the definition and the guidance that we have for placement of youth in a specialized setting. So for youth who have been sex trafficked or commercially sexually exploited, that would be identified by the child welfare worker or caseworker, and that may or may not involve a third-party trafficker. So the third-party trafficker or facilitator is required for a child protection investigation, but that third party is not required for a youth to qualify for a specialized setting. And then the commercially sexually exploited youth definition in 260C .007 subdivision 31 has been updated to include commercially sexually exploited youth. And again, that may or may not include a third party. And then through the sub work group process, as Sarah mentioned earlier, we developed the at-risk definition. And when that was developed, there was a large stakeholder engagement process. And so we looked at what are the primary risk factors. So for a youth to fall under the at-risk definition, if they have experienced commercial or non-commercial sexual exploitation, if they're connected or involved with others who have exchanged sex or for anything of value, so whether it's family or friends that have engaged in that activity, or youth that are experiencing wage theft, labor trafficking, or exploitation. Just one of those factors would qualify a youth to be considered at risk of sex trafficking or commercial exploitation, which would then qualify them for a specialized setting. The secondary risk factors include experiences such as homelessness, drug use, abuse and trauma, family conflict, and gang affiliation. And on the next slide, you'll see a document that we have created as part of the work group process, and that we've created that we created to help workers identify what those primary and secondary risk factors are. And I don't know if you can make that a little bit bigger. So this has been emailed out. And so I don't know if that link works, from the PowerPoint as it's been emailed out, but this is available on our Safe Harbor website. It is on there now. If you look under the Family First tab on the Safe Harbor website. And then the other thing that I just want to note is that when you're determining whether or not a use is at risk, it's important to consider the intersectionality of cultural identity and societal oppressions and how those factors can contribute to youth being placed at a higher risk of trafficking or exploitation. And then for Patty, just touching base on Patty's question regarding the unintended consequences, that is something that we certainly have talked about and acknowledged throughout this process. One, with the at-risk definition, we know that that might have a bigger umbrella of youth that would qualify for a specialized setting. And so is there going to be an unintended consequence that youth have that they may be placed in a specialized setting and not have to go through the process such as a QRTP process, which is a little, that has more requirements for the out-of-home placement to happen. And so that is a conversation that we've had throughout this. And I do want to highlight what Sarah previously spoke about and mentioned was how the importance of this with the specialized setting and with the certification that youth who are considered to be at risk will then have access to within the residential program, whether it's a shelter or a treatment program, they would have access to the trafficking prevention curriculum. And that really is something that makes the certification unique in what the requirements are. So again, this handout is available right now on our Safe Harbor website, which when you have the PowerPoint, you can maybe click at the bottom, maybe that won't work, but we also can send a link to it. Okay, you can go to the next slide. Okay, so how does the Child Welfare Agency determine the most appropriate placement? So it is important to, we still have to look at what is in the best interest of the child. What are the youth's connections to the community and family? What are their medical, mental, or chemical health needs? And then the individual needs of the child and the family. Maybe it's a situation where the child is ICWA eligible and a congregate care setting specializing in sex trafficking isn't the most appropriate option at that time. And then some of the unique things to think about with this population are the risk of absenting from the home, from the youth's home where they were living or where they are living, or that out of home placement. So for example, there are times where a youth is, being trafficked, and maybe having them remain in their community at a shelter where their trafficker knows where they are and can easily access them or pick them up. Maybe that location in their home community isn't the best at that time. So that's something that certainly needs to be considered in the process of evaluating the appropriate placement. The other thing is concerns of recruitment of other children. Maybe there's a youth that you're working with and they were trafficked by the same individual who, and then maybe there's a youth that you're working with who is trafficked by an individual who also trafficked another youth, and that youth is in one shelter setting, and maybe it's not best to put them together, and maybe there's a history of recruitment between those youths. So sometimes youth may be coerced by their trafficker to locate other youth that could then be trafficked by that individual. And so if there's a concern of recruitment, that's something that needs to be evaluated too, or a concern of maybe the youth shouldn't be placed with other youth within the program. And it's really an individual basis that needs to be evaluated. You can go to the next one. Okay, so I mentioned a few things earlier, but when you may not want to consider a specialized setting. So again, if it's a ICWA, if there needs to be an ICWA or MIFA preference, then maybe an at-risk or a specialized setting is not the most appropriate option, because maybe that child could be placed with a kin provider or a foster family that would better suit their needs. If there are chemical dependency or substance abuse concerns, maybe that youth might need a chemical dependency treatment program first before a specialized setting, or if they're going through withdrawal, if they need a hospital medical type setting to address those immediate medical needs or substance abuse concerns or mental health concerns. If there's a youth who has an adequate support system through their family and community supports, and they're able to keep that youth safe at home and supported at home. Ideally, obviously, this is always the best option if it is safe to do so. We would like to keep youth with their families to the best extent possible, or an alternative arrangement maybe developed in partnership with their family. Because, families oftentimes do want to be involved in their youth's safety and are able to connect them with community-based resources to support their safety and well-being at home. And then also, if a youth needs a higher level of care, for example, maybe there's a shelter bed available that is a specialized setting. However, maybe that youth needs a higher level of care at that moment for, again, if there's like a mental health stabilization need or something that would be better suited outside of a shelter setting. Okay, next slide. Okay, so the key considerations that apply when working with sex trafficked, commercially sexually exploited, or at-risk youth. There is no requirement for a juvenile treatment screening team when placing in a specialized setting for trafficked, exploited, or at-risk youth, which is different than the process that will be for a QRTP. There will be a required judicial review at the 6-month point. That will be required. And then the other things that are more distinct from the QRTP placement process is that there will be no qualified individual assessment, and there will be no family permanency teams. And these are all statutory requirements and changes. So
you're muted, Darianne. So as Darianne was mentioning, these are unique statutory changes that have happened in recent legislative sessions. So these do not apply broadly to any youth who's identified as being trafficked, exploited, or at risk, but specifically when a youth is being placed in a specialized setting. Are you back, Darianne? Now your mute is on. I see you're a little muted.
I am back, and sorry.
There we go.
Can you hear me? All of a sudden, my phone just hung up, or it just said call ended. So I'm really sorry. Technology. So Sarah, you probably just already said all this. So what are your partners what do your partners need to know about this process as, within the next few weeks leading up to the implementation of Family First, which goes into effect October 1. And so some of the things to think about are, are your county attorneys or tribal attorneys, are the guardian ad litems that you're working with, are they, what are the judges like? Are they aware and understand the unique needs of this population for sex trafficked, commercially sexually exploited, and at-risk youth? And are they aware of what a specialized setting can offer? And this is going to be one of the things that as FFPSA is implemented and as these changes go into effect, it's going to be these ongoing conversations that you all are having with your partners and those involved in the placement process and decisions. It is something that we here at DHS continue to make outreach, and we'll continue the process of partnering with everybody that we can to make sure that they are aware of these changes that will be going into effect. Sarah, I don't know if you want to add anything else to that. Otherwise, I think that was my last slide.
So yeah, thanks, Darian. So the other, as you are thinking about who is part of your team at the local level in terms of placement process, who might be involved in different types of placements, and thinking about training really, and thinking about having some coordination conversations, please be sure to include Safe Harbor partners in those conversations. We're going to hear in just a moment from Dina about the Safe Harbor response in Minnesota and how it relates to all of this. But before we change to that, one last slide before Dina, I wanted to just let you all know that one of the big statutory changes in this session that we are just so excited about is a new training requirement. Yay! All child protection staff, or in other words, as it says in the statute, all staff with child protection duties under Minnesota Statute 260C or 260E must now take approved training on trafficking and exploitation and the coordinated response to trafficking and exploitation. So that went into effect July 1st of 2021. It was part of our Family First proposal, because in order for us as a workforce across the entire state to identify every youth who is going into placement, every single youth, identify whether they are at risk for trafficking or exploitation, or whether they have been at some point trafficked or exploited, we found it absolutely essential to make sure that every staff has training on working with and identifying this population. So please, my contact information is on the slides. Please reach out to me if you are someone who fits into this category of individuals and you are interested in finding out more about the training. So I will say also, we are developing training for residential facilities that you will be learning about a little bit later. And that training will be publicly available and also may be an excellent resource for that list of partners that Darian was talking about earlier. So, and with that, I am going to hand it over to Dina. The Safe Harbor response is a key part of what services look like for youth who've experienced trafficking or exploitation or who are at risk in Minnesota. So we want to anchor you all today in our Safe Harbor response. Go ahead, Dina.
Okay, hi everyone. Can you hear me okay, Sarah?
Yes.
Okay, great. Yeah, so I'm Dina Chu. I also work at the Department of Human Services in an area called the Office of Economic Opportunity. And I am a grant manager and program administrator for a state funding source we have called Safe Harbor Shelter and Housing. So I'm going to give kind of a brief history of our Safe Harbor system in Minnesota and talk more specifically about our Safe Harbor Shelter and Housing programs that we have across the state. So you can go to the next slide. So our safe harbor response in Minnesota kind of has three main components. One is the decriminalization of prostitution for people under the age of 18. So minors who are engaging in prostitution or commercial sex, that is decriminalized in our state. And then another part of the response is the child protection response, which you've been hearing about from Sarah and Darianne. And then the other part is our safe harbor services, the network of services that we've created to support youth who have been engaging in commercial sex or who are at risk. So I'm going to talk a little more specifically about the decriminalization and then the safe harbor services. So you can go on to the next slide. So this is just kind of a brief history. So the safe harbor law that decriminalized engaging in prostitution for people under the age of 18, that law was passed in 2011. And then we took some time to create a system to now serve youth who we are seeing now as victims of sex trafficking and sexual exploitation rather than treating them as criminals. So that law actually went into effect in 2014, the decriminalization law. And then as a result of that, creating this new system, there were these safe harbor services that were developed. And after a couple years, it wasn't right away in 2014, but the law then sort of changed so that people who have been sexually exploited or are at risk who are the age of 24 or under are eligible to receive these safe harbor services. The decriminalization part is still only for minors, but the eligibility for safe harbor services goes all the way up to the age of 24. So you can go to the next slide. So this is just an image of from this report called our No Wrong Door report, which was sort of the model that was developed between 2011 and 2014 to make sure we are responding again to the youth who we now see as victims and people who need support and services rather than people we're criminalizing. So this is just kind of an image. There's a link there to the report that you can find. This report is from 2013. And it just shows that we had come up with this no wrong door model, so that the idea is that a youth could be identified as someone who's experienced sexual exploitation or trafficking, or who is at high risk by really anyone, any professional, not just one system or one door, and then hopefully can then be referred on to appropriate services that would meet their needs and address their specific experience of trafficking or exploitation. Next slide. So this is kind of another image to illustrate that, just showing that with Safe Harbor, we think it's just really important that there's connections made between all kinds of different systems, that those connections and collaboration is really important to responding to instances of sex trafficking and sexual exploitation, and making sure that all the needs of the youth are being met. And again, that no matter where a youth might be identified, that they can then get connected to the services and support that they need. Next slide. So there were kind of three main types of services that were developed, that were developed for the Safe Harbor system, and there is state funding that was allocated for these three things. So specialized supportive services is kind of one bucket of funding that we have, and that is administered through the Department of Health. And that encompasses like a wide array of different services that are in the community, from legal services to mobile case management services, culturally specific services and some mental health services, but that are specifically geared towards serving the population of youth who have experienced trafficking or exploitation. And then our safe harbor system is really based on our safe harbor regional navigators. So the state is split up into several regions, and in each region, there is a regional navigator, and that person is kind of, or the agency is sort of the expert in their region on their more local response to sexual exploitation and sex trafficking. Their job is kind of to make the connections with professionals in their area that are engaging with youth and may identify a youth as being trafficked or exploited, providing training to people in their region, helping to develop a protocol, also respond, helping kind of provide that initial response when a youth is identified. A regional navigator is a great first call if you're a professional that thinks you've identified a youth as having experienced trafficking or exploitation. You can contact the regional navigator and they would kind of get you connected to or set you on the path to support that youth with what they need. So that's another part of Safe Harbor and those agencies are also funded through the Department of Health, which is where Department of Health is kind of where our Safe Harbor system lives and is led from. And then there's also specialized housing and shelter programs, and those programs are funded again through the Department of Human Services, and that's kind of the part of Safe Harbor that I focus on. And so I'm going to talk a little bit more specifically about those programs. So next slide. And this is just an illustration again of what kind of our Safe Harbor system looks like. You can see how the state is divided up into different regions, and you can kind of see where these services are scattered across the state. So we've tried to make sure the state that there's some Safe Harbor services in all the different regions of the state, because we know trafficking and exploitation happens everywhere, and the need for services is in all parts of the state. So you can access this map too on the Department of Health Safe Harbor website, and probably also by going to the Department of Human Services Safe Harbor website too. Next slide. So a little bit more specifically about our shelter and housing services. So our funding actually goes towards shelter, housing, and outreach. So we fund some programs that are considered shelter. So this is more like short-term, emergency, residential care, where we're just kind of trying to provide a safe place for these youth and help them stabilize. And hopefully they wouldn't stay there for a long period of time. We also fund some services that we call supportive housing, which could be for longer term. And this may be a place where a youth might go to a shelter first and then move on to housing. Or like I said, Safe Harbor services can go up through the age of 24. So we have some housing programs where they provide, they help a youth kind of access an apartment, help them pay their rent so they're living on their own more independently, but would also receive case management services and those supportive services. So some of these programs are serving minors and could be accessed through a child welfare placement. There are other Safe Harbor programs that are for an older age range. And so there's a variety of different models that we fund. You can go on to the next slide. So again, this is kind of what I had already just said, but we have programs across the state in all different areas, kind of like Darien had talked about earlier, especially with the population of youth who have experienced trafficking or exploitation. It may be most appropriate if they are going into a placement or into a residential program. It might be better for them at the moment to go somewhere outside of their local community if they're trying to get away from a trafficker or something like that. So all of our Safe Harbor funded programs are able to take referrals from anywhere in the state. So sometimes a youth that lives in the metro may go up to a program in Duluth or Bemidji or vice versa for a period of time. So that's kind of one unique and good thing about our Safe Harbor programs. Again, there's lots of different program models that we fund. So not all Safe Harbor shelter and housing programs are exactly the same. Some are congregate facilities, some are scattered site, meaning they're out in the, the youth just live out in the community in their own apartments. Some are short-term, some are long-term, and some serve like different target populations, gender specific, or all genders, or we do have a couple programs that are more culturally specific. So there's a wide variety, and you can find much more detailed information about the programs that are funded through Safe Harbor on both the Department of Health and the Department of Human Services Safe Harbor websites. Next slide. So again, this is just kind of some components of the programs that are funded by Safe Harbor. So with the shelter and housing programs, they're all specialized programs that are providing services that are very specific to youth who have experienced sexual exploitation or trafficking. So this is similar to things Sarah mentioned earlier, but that like safety is really important. They're usually staff secure facilities. They're not facilities that are locked because, again, we're not treating these youth as criminals that are being locked up, but as victims that need services. So while they're not locked facilities, they are usually, have a very high staffing ratio and are secure in that sense. All the programs have a goal of being culturally responsive, meeting the youth cultural needs. And like I said, we do have a couple programs that are more culturally specific to a certain group. It's really important that they all have really strong connections to local systems like law enforcement, the county child welfare agencies, juvenile justice, schools, kind of all the important systems in their region to meet the youth's needs. Trauma-informed services are so important, and so all the programs have case management and do things to meet the mental health and chemical health needs of the youth. Some programs have employment programs, and of course, if the youth are school age, their educational needs would need to be met. So they have really robust programming. Incorporation of survivor voice is also a big value in Safe Harbor. So there's some type of survivor involvement in all Safe Harbor programs, whether that's survivor mentorship or having advisory committees or having survivors on staff or having survivors that kind of inform the policy and program development of the program. And then I want to make the point too that all the Safe Harbor funded programs that are serving minors, they all have to be licensed by the state, as any residential program serving minors has to be. And many of our programs, well, all of the programs serving minors have historically been eligible, have had county contracts and have been eligible to receive Title IV reimbursement. And my understanding is that all of our Safe Harbor programs that we fund that are serving minors are pursuing this specialized certification. I can't say that they all have the certification yet, but I believe they're all pursuing it, and that Title IV funding source is a really important funding source for the programs. Our Safe Harbor state funding, that grant funding, is really great. But it is a limited funding source, and it's not something that fully funds Safe Harbor programs. So the other funding that the programs get, including the Title IV reimbursement, is really important to the sustainability of those programs. Next slide. I'm almost finished. So again, I just wanted to reiterate the no wrong door model. So again, all of our Safe Harbor programs, the shelter and housing programs, like I said, they can take referrals from anywhere across the state. They can also take referrals from any system or any individual person in the community. So child welfare and child protection can definitely make kind of formal placements into Safe Harbor programs that are serving minors. Also, sometimes law enforcement brings a youth to a safe harbor shelter in more of like an emergency type situation. They can be referred by safe harbor regional navigators or other community service providers. They could also just self-refer, walk up to a shelter and say, I need a place to stay, or be placed, or a parent could call, something like that. So there's different ways that individuals access safe harbor shelter and housing programs. And if that youth is a minor and accesses a safe harbor program, if they're not already connected to a county, the program, the safe harbor program, would have the responsibility to contact the parents of the youth or the county. And so there should always kind of be a county connection made if it's not made before the youth accesses the safe harbor program, if that makes sense. So just wanted to make that clear. And then, yeah, you can go on to the next slide. I think my last slide is about gaps, which again was kind of referred to earlier in the presentation, but we have definitely seen gaps, like Sarah was saying, in meeting the mental health and chemical health needs of youth in the safe harbor system. So our safe harbor system has grown a lot over the past several years, and we have some really fabulous programs, but we definitely still have gaps and still have needs that we can't meet. We have some programs that are gender specific to females, but we don't have any programs that are specifically designed to serve males. We also have some programs that serve youth of any gender, which is fantastic, but no male specific programs. We would love to have more culturally specific programs, programs that are able to better meet the needs of youth with certain disabilities. Also, we hear a lot that youth who have their own children, there is a huge need for more shelter and housing for that population too. So the hope is that with this new certification that is going to be helping programs kind of get up to speed on specializing and being better trained to serve this population, that it will help to fill some of the gaps in the placement needs for this population of youth who have been trafficked or exploited. So that is the end of my slides, and I think I'm turning it over to Kirsten now.
Thanks, Dana, and hi, everyone. My name is Kirsten Anderson, and I am the Executive Director of Aspire Minnesota. We're an association of children's service providers that serve across the state. And I am so delighted to be with all of you as we work together to build a response to Family First Prevention Services Act and to create additional capacity in responding to children and youth who have experienced sexual exploitation or commercial sex trafficking or are at risk of any of that. So I am really, again, so heartened by everything that we've heard today. We have an incredible team that has done so much really thoughtful work since the beginning of this whole process. So it's with deep gratitude and such an honor to be in their company and in your company. So we can move to the next slide. I love what Dina just outlined, because I think that this opportunity to build our capacity in response to children and youth who have experienced sexual exploitation or at risk, it really is part of our journey of building our continuum, of building our response so we can be increasingly individualized in our responses to children and youth and families. And as we see from Dina's presentation, we really began as a vanguard in the state of Minnesota, over a decade ago, examining the issue of sexual exploitation in young people and decriminalizing it first and foremost, and now are deepening our understandings, our capacities to really increasingly prevent by equipping young people and children and families with an understanding of how to equip themselves and build skills so they aren't in circumstances where exploitation may occur. which is really so positive and so potent for our continuum. Today, I'm going to talk a little bit about the specialized settings and the definitions here. And again, to me, it's really a continuation of that conversation about building capacity. You know, for a number of our member organizations, they have been on this path, meaning they have been doing training of staff. They've been providing groups for young people to further equip themselves. And now they've been certainly practicing trauma-informed care. And now this opportunity gives them the ability to articulate that further in policies, bring additional training into the culture of their organization, and really, I think, is very much viewed as a positive opportunity. And part of what I think is important for us to increasingly understand as we build this together with this family first shift is that it's a both and, meaning that we're building capacity and we're also conducting services for specialized needs of young people that were previously happening within each of these service providers. So it's not necessarily that this new definition and certification that is being attributed to organizations fundamentally shifts. It simply is an enhancement. It's a building of capacity for staff and all those attached to the services, and particularly for youth served. So, as we know, here is what is required. That the certification requirements include a specialization in serving youth who have been or are at risk of sex trafficking or commercial sexual exploitation by establishing and further articulating, in some cases, the trauma-informed model of care and how that really is lived into by kind of every part of that organization. Safe setting designed to prevent ongoing and future trafficking. So that safety element that Dina was speaking to, of course, always of critical importance. And as we heighten awarenesses around some of the other vulnerabilities that young people may experience, this is just a really important awareness raiser, and also, policy changer and structure changer potentially as needed. Providing equitable, culturally responsive, and individualized services, assisting youth with accessing services based on individual needs, providing educational, life skills, and employment supports, offering a trafficking prevention education curriculum, and having direct contact staff that are trained by DHS on human trafficking. We can go to the next slide. So the staff training for programs for youth who have been or are at risk of sex trafficking or exploitation, that will be required by January 1st of 2022. And staff will be trained on introducing human trafficking and exploitation, building upon skills and expertise that staff currently have, promoting the 5 principles and the safe harbor response, and using the power of stories to increase understanding about youth needs. So again, I want to take a little step back and really celebrate the team that's coming together to have this conversation with you today, and say that they have been so thoughtful and responsive about how to create these trainings to make sure that that the training itself is highly valuable, filled with content that everyone agrees is critically important for staff to know, and is really accessible, because we know there are lots of demands on staff, and we want to make sure that they're gaining information that is both that's available, that's relevant, that's accessible, and that they can then carry forward with them in their work with young people. So that's just really want to say a word of gratitude. This is really some high quality work that we've observed and been part of. So thank you to this team. And let's move ahead. Programs for technology. Programs for youth who have been or at risk of sex trafficking or exploitation. The youth education is another really important part of what we have come to value about the certification. And that allows for the program to use its own trafficking prevention education curriculum or the Not a Number curriculum, and staff to become certified to facilitate a not a number prevention group with youth ages 10 to 20 in facilities. And I think this is a great, as I said, many organizations were already doing this work, and this has been another great way to enhance those services for young people, with really a focus on equipping, building skills, heightening awareness, doing all those things, so we really can build the capacity of our continuum to the benefit of young people. You can go ahead. So for these residential programs, the youth survivor quote here is that they're looking for a place with people in similar situations where people won't judge you by what has happened to you or by your race or religion, or also a place where you know someone dangerous won't come in. Control is kind of comforting, a program where they let you decide for yourself, let you grow on your own. And those observations and experiences are so important as we continue to think about these certification qualities and how it is that organizations can live into this next chapter of our continuum development. A few things to consider about the continuum of programs. Programs may serve either population or both. The safety and service delivery may vary based on population served. The different types of programming and service delivery models will meet the needs of young people, and that mental health is a major concern. So, I think that the Minnesota story is so wonderful in that it began, over a decade ago with deep research and understanding about trafficking as a crime, and shifting our whole mentality to honoring victims and helping them to gain the support that they need to be their full selves in the community. That's the goal on that side of the equation. And as Sarah mentioned at the beginning, mental health continues to be a really significant concern, very understandably based on the level of trauma that people have experienced and the cycle of responding to mental health symptomology and mental illness that may arise from layered trauma. And in some other states, their safe harbor responses prompted by federal initiation started in other circumstances in the mental health system. And so in Minnesota, we have this opportunity to really now bring the knowledge that initially began in our homeless youth responses into the full continuum of our child welfare and our mental health responses, which is so fantastic because that really allows us to get to our shared goal of individualizing services for young people and responding to their needs, both as we think about that immediate placement and as we think about their journey and where they may need services in the future. So I think that's my last slide, but maybe not. It is. Well, thank you very much for letting me visit with you. And again, my deep gratitude for being part of this wider team.
Okay, let's see, 1 second. I can't see. Okay. Sarah, are you ready for me?
Yes, go right ahead, Anna. Thank you.
Okay, all right. So can you see me? It seems like I lost my video.
No, we do not.
Oh, there.
There
okay,
you are, Anna.
got it. Okay. All right. Thank you, Sarah. All right. So let me just quick 1 second. All right. So my name is Anna Chalupka, and I am one of the SSIS trainer. And today I'm going to talk about and show you what those screens, SEY, STY, at-risk screen in SSIS. But before I get started, I want to just put it on the chat the link for the SSIS tutorial for trafficking and exploited data entry. Specifically, you want to look at pages 11 through 19. So I'm going to copy this. Okay, and then also with this webinar, it's going to be posted on our Minnesota Child Welfare Training Academy, and this is the website for that. If you could just give us a few days to give us some time to post this recording, and if we have any question and answer documents, will also be posted on this website. And then lastly, before I get to my screens, I wanted to put a link on the webinar completion form. If you wanted to get credit, it is located in this link. Okay, All right, so with SSIS, yes, so we do now have a new label. It used to be just the SEY, STY, now we're added at risk. In this screenshot, you can see that we didn't really do a lot of changes on this SEY, STY screen. It is still a required field, it's a required thing for screen for many child welfare related work groups. The add screen option is now added in SSIS. And on the right-hand side, this is what it looks like when you open up the at-risk folder. We have the primary risk factors are listed over here, and then our secondary risk factors are listed over here. Depending on what you selected for the primary and secondary, it will show you if this youth meet definition of at risk of sex trafficking or commercial sexual exploitation. And this one I have highlighted this to show that if it does apply, it is applicable, it will say yes. Now on this screen, it's about placement for sex trafficked, commercially sexually exploited and at-risk youth. For children that are in placement and they are at risk for, at SEY or STY or at risk, we have these two new settings and reasons for in the SSIS. So we have group home staff operated, and it's the sex trafficked, commercially sexually exploited at risk. And this will create that applicable certification of SEC at risk. And then another option is the setting of residential program. And again, with the same reason of sex trafficked, commercially sexual exploited at risk. And that would also create in SSIS an applicable certification of CSE at risk. So in order to qualify for Title E reimbursement, we will need to have these settings selected in SSIS. Also, if a child is in placement, you need to link that documentation of SEY, STY, or at risk. With this example on the screenshot, I have I'm under the placement locations and absences folder, under the placement with this youth, I do have an at risk or SEY, STY. What I would do is right click on the option or the folder or go to your action menu, and then you will see an option for adding existing SEY, STY, or at risk. Once that is selected, now you will see the screen. It looks like this. And this is where you would click on the down arrow, and you will find the one that you want to link. You would only link the ones that has an applicable certification of yes. And you would only choose one. And once you have chosen your which document to link, the appropriate documentation to link, down below I have a couple of examples here that if you put the address, it's going to show up under the placement folder, and then it will do the same thing for SEY, STY, and it will show under the placement location and absences folder. At 3 o'clock, we will have an SSIS coffee talk, and I'm going to go into the live training environment for SSIS. So if you have any other questions, or if you would like to see what other options that we have on those drop downs, please feel free to join us at 3 o'clock. Okay, I think that's all I have. Thank you so much.
Okay. Anna, thank you so much. Kirsten, Dina, Darianne, thank you all. So we now are going to come back to where we started talking about impact. And I hope that, I know this is a long time. I know that we've all been sitting here for an hour and a half so far. So if you need to stretch or take a quick break and come back or anything, please go ahead and do that. I want to make sure that we have time to talk over a little bit more about these impacts, potential impacts, and also give you a little bit of an update on the process, and then answer any questions that you all have. So as we are coming into the final stretch of our time together today before the coffee talk, SSIS coffee talk, if that's something that you are attending, I would like to really invite you all to pause and think about what questions do you still have that we can answer either today in our time together, or that we can answer in writing on that Q&A document that we're going to be sending out. So please go ahead and use either the Q&A or the chat to send in any questions that you want us to discuss. So coming back now, after this rich discussion, coming back to the impact that we could see through creating and utilizing these specialized settings for youth who have been or are at risk of trafficking or exploitation. And at this point in the presentation, we're doing pretty well on time. And I would like to invite, if any of the panelists, as we are going through these impacts, if you have comments that you would like to add about these impacts, please feel free to unmute and add in. So let's talk through these. Let's talk through these again. Now that you've learned a lot about the specialized settings and the definitions and everything. So short-term potential impacts of creating and using these specialized settings. First, we believe that in the short term, right away, we will see a greater level of access than we have ever had in Minnesota to residential program staff who are trained in serving this population and who are offering human trafficking prevention education for youth. So that is, again, Kirsten walked through that with you, two of the real distinguishing parts of this certification type and of these specialized setting standards are really that staff training requirement and the human trafficking prevention education requirement. Noting also here that those are pervasively across the country, the main distinguishing factors about these specialized settings. Also, short-term potential impact. We hope that by placing youth in these specialized settings, that they will ultimately get more access to our safe harbor response that Dina talked about, that there will be better awareness about safe harbor and a higher likelihood that these youth, especially upon leaving the program, would be connected to the appropriate safe harbor resources within the community that they are returning to after out-of-home placement. So that would be a huge, huge benefit for youth across our state. One final short-term impact. We do hope, of course, that there will be better services and possibly through the Title IV reimbursement and the increase in the number of programs wanting to serve this population, we hope that actually there will be more beds available in a wider variety of types of residential programs, building upon the excellent work already being done in our safe harbor shelter and housing programs. And let me pause for just a moment. If any of the co-panelists wanted to comment on any of those impacts, I would welcome that. Okay, then I'm going to move on to the long-term impacts, and you're still free to jump in if you would like to. So some potential longer-term impacts that I want to talk about a little bit more. So by creating these specialized settings also for youth who are at risk of trafficking. And by requiring trafficking prevention education for all youth who are placed in these specialized settings, we actually have the chance, everyone, of preventing trafficking from happening to youth or preventing it from happening again. So as we were talking earlier about just what the definitions are for trafficking and exploitation and what it means to be at risk, I hope that that has enlightened for you a little bit of how broad, how many youth really could be at risk. And I'll tell you just here briefly, in the early days, in the first several months of convening stakeholders and engaging with residential programs and engaging with counties and survivor subject matter experts across the state, I will never forget one conversation that I had that you know, in a particular part of the state, in a particular community, there was some real kind of confusion around, you know, how would we think about a small treatment home for male youth who are crossover youth within the juvenile justice system and child welfare system, who have been, you know, they've been accused of, or they've actually been maybe even adjudicated delinquent for various types of juvenile delinquency, including even maybe sexual misconduct offenses. How would we think about them as fitting into this at-risk youth definition? And some really pioneering, real detail-oriented staff from some of the programs on both the child welfare side and on the residential program side were looking at the definition of at-risk and going, maybe we could consider these kids as actually being at risk for experiencing trafficking and exploitation, even if they themselves have been on the other side of the equation, maybe involved in the delinquency system. So I think long-term, there is a potential here to change the way at the broad level across our whole state, how we think about risk for trafficking and how we think about which youth do experience trafficking and exploitation, youth of any gender or gender identity, youth of any age, youth from many, many different populations and backgrounds. And then finally, as Kirsten really talked about, we have the opportunity long-term to really feel, and Dina talked about this as well, a huge need, a huge gap that we have in our state right now today for youth who have experienced trafficking or exploitation who are at risk or who are at risk for subsequent trafficking, to really provide higher level mental health and therapeutic treatment services for these kids. So that's some of the potential impacts that we hope to see. That is what this response in these specialized settings have really kind of proactively, from a human-centered design perspective, been set up to try and work towards. So I want to invite you into that and invite you into that journey to try and really not only potentially see these impacts, but really work for these impacts to be fulfilled for our youth in our state. Next slide. Okay, so now the moment that you've been waiting for. What is happening? What is the process? Is this actually going to happen on October 1st? Gosh, there are so many questions and we share so many of those with you. So in the spirit of trying to have a little bit more clarity, I just wanted to sort of boil it down step by step here. And this has been stated in many different ways, but here's the Sarah Ladd iteration of it. So licensed programs can apply anytime. Today, you can apply at any time going forward. DHS or DOC licensed programs can apply through DHS licensing for this certification type or any of the other 3 certification types. As of today, 13 programs have submitted applications already for this specialized certification type. And so once programs do get approved for their certification, then counties and programs would discuss county contracts, and then the county would seek Title IV-E approval through DHS for the particular residential programs that have been certified. Then once the programs are approved, then I'll show you the slide next. You'll also be able to see which programs are certified in which type of certification on the licensing information lookup, so that anyone can access that and know when you are making placement decisions. And then children who are identified as being trafficked, exploited, or at risk, meeting those definitions and documented as such after September 30th, which is when these SSIS changes that Anna just walked us through will go into effect. They may then be placed in these Title IV-E approved programs, and then Title IV-E reimbursement can be claimed for those placements. So I want to note for all of you that this is all it's all a moving process right now. So please do not hesitate to look at these resources that we've talked about, to reach out. Please go ahead and contact me. I can connect you with any of the panelists and can help to answer questions that you might have about training or training for anyone involved, either the required training for child protection or required training for residential facility staff or training for partners that may need this training. So please don't hesitate to reach out, not only to me, but also if you are a facility, to your licensor to ask questions as well. So next slide, this is just a quick screenshot here, and there should be a link also to the licensing information lookup. And sorry for the error in the title. This is the general licensing information lookup, not only the foster residence settings, I do believe. Ashley, correct me if I'm wrong about that. So you will be able to see on licensing information lookup, once programs are approved and certified, you'll be able to see that indicated when you look up that residential program on this website. Okay, so next slide, we are nearing the end here. So we have had some questions come up during the presentation, and I think please do continue to submit questions, any questions that you'd like us to answer right now. But while we're waiting, we will try to answer some of the questions that have come in already. So Darianne, I wonder whether you might be able to address the question around payment. And then Dina, if you want to add anything additional regarding anything specific pertaining to the connection with safe harbor programs, feel free to jump in as well if relevant. Darianne, do you want to repeat the question first?
Sure. Can you hear me?
Yes.
Okay, so Patty asked at the beginning when you were discussing the child protection response and investigation, does the youth get a worker and county pay for placement if the trafficker is not family? And so the short answer is yes. And I want to tie that back to how these reports might come to the attention of a child welfare agency. So for example, if there is a report screened in for an investigation where there is known or suspected third-party trafficking of a child, and that person is a non-family member, non-caregiver, that is required by statute to be a child protection investigation. It falls under sexual abuse. And so there would be a county worker assigned if there is a report of trafficking. The other thing to remember is that if a report comes in and it doesn't quite reach the level of trafficking, where there's not a third party, but there are concerns of sexual exploitation, then that also can have a county worker respond under a child welfare response. And so anytime that a child is placed in and out of home placement, whether it is a shelter or a safe harbor shelter, that agency or that program should be reporting that placement to the county. When that report comes into the county, the child welfare agency, the screener will determine whether it's a child welfare response or a child protection response. And Dina mentioned earlier that there should be that connection when there is a connection to a county worker when there is a placement in a safe harbor shelter. So what the child welfare agency would do is, if a youth, say they self-refer to a safe harbor shelter where youth can do that, or a family could refer their youth, that safe harbor shelter currently, how everything currently is as is, and the safe harbor shelters will continue to operate as they are now. But in order for the youth to remain at that, so the youth would come in, say the youth self-refers or the family refers the youth to the program. That program should be making a referral to the child welfare agency. That would be assigned for an assessment, whether it's child welfare or child protection, to determine the appropriateness of the placement and if that youth should remain in the placement, and the child welfare agency would be responsible for that placement. And so that is part of the assessment process. With the changes with Family First, we would, the worker or the agency would then have to determine if that is the appropriate placement, if there's a special if there's an alternative placement that might better suit the youth's need, like maybe they're in need of a higher level with a QRTP type setting or a residential program. But there should be that assessment process completed to determine the agency responsibility to the youth and to the placement. And so, Patty, going back to your question, does the youth get a worker and county paid replacement if the trafficker is not family? Yes, the youth should still have a worker assigned to investigate the trafficking concerns. And then that payment would be an assessment process during, because sometimes placements happen before an investigation is open, and sometimes they happen during the time an investigation is open, or case management even. So I hope that.
Okay, so Darianne, thank you for that. I guess the only other thing that I would add in response to that question is that a key part is really the agency, the child welfare agency, determining whether they have to actually have placement authority. So they would have to get that placement authority in order to be able to pay for that placement. So just having a worker assigned or an investigation being conducted is totally separate. Not totally, it is actually totally separate legally from actually having placement authority and deciding to remove a youth or to have them in an out-of-home placement. So that's a different process that can start during an assessment or investigation, but it doesn't always happen that way. So, and
the placement would have to be entered into SSIS. So there has to be that legal placement authority. So whether it's a CHIPS court order or a voluntary placement signed by the parent, or if there's a 72-hour hold, and then that starts the other process. But that would then have to be entered into SSIS, just like any other placement, in order for payment to be generated.
Yep. Dina, did you want to add anything at all about this, or did we cover it?
No, I think you guys covered it. Thanks.
All right. Okay. So other questions to talk about right now? What else do we have?
Sarah, I don't know if you wanted to add anything else to Patty's other question. Are we balancing this work? How are we balancing this work between the need for services and the issues and unintended consequences of labeling a youth as such?
Yeah, absolutely. That is a really important question, and one that we spent significant time on regarding the like during the work group, really regarding, how broad do we want this definition to be, was where we were talking about, especially the labeling, the unintended consequence of labeling. And so definitely a couple of things to know about this is that the identification of youth for placement purposes really is identification in the SSIS database, right? It's something that the worker does so that they are eligible for this type of placement. So on one level, it's kind of a pretty practical, logistical thing that has to happen. On the other level, though, really, if you think about placing a youth into a specialized setting like this that is filled with other youth who have experienced trafficking or exploitation or who are identified as being at risk, you really want to have a conversation with the youth and the family, and you really want to figure out whether they are ready for that type of an environment and how to talk about that with the youth. Because many, if not most youth who have experienced trafficking or exploitation and those who are at risk are not going to they're not going to identify themselves that way necessarily. And so it is really important to have a conversation about what these programs can offer. And really, that's kind of the other big side to the labeling question in my mind. So I will say that we're trying to strike a balance, Patty, in terms of keeping the information about the youth, about the identification of the youth as meeting these definitions as private as possible, but also really having conversations with the youth about what they need and what these services might look like if they do end up going to a specialized program. So that's how I would answer that. Do any of the other panelists want to add anything about that question? No? Okay, has anything else come in? Any of the other panelists see any other questions that came in that we'd want to try to address right now?
I don't see any other questions.
Okay. All right. Well, there are a few resources here in the slides for you. These are really the nuts and bolts kind of policy bulletins that have come out about various aspects of Family First. You see the second bulletin linked on here is our bulletin about identifying youth for these specialized placements, youth who've been trafficked or exploited or who are at risk. And then on the next slide, you will see my email address, and you will see also our DHS Safe Harbor website, and links again to those bulletins and resources that we talked about earlier, as well as the DHS Family First website, where many of you probably found this webinar. So thank you very, very much for attending today. Thank you for your participation in this process. And please don't hesitate to get in touch if you do have more questions or want to discuss really any of what we have covered today. And thanks to all of my amazing co-presenters. Really value you in our work group process over the last couple of years, and in particular today on the webinar.